How to achieve all your dreams. Keep moving forward. Never accept less than who you are. Live your best life. Be strong and free. It's the Hit Back with Natasha Black. It's the Hit Back with Natasha Black. It's the Hit Back with Natasha Black. It's the Hit Back with Natasha Black.
Good afternoon, Bahamas, and welcome to the Hit Back. I'm your host, Natasha Black. It's a beautiful day here in the 242. I hope that everybody's doing well, that you are taking care of yourself, that you are living your best life. We got a full show for you today. We have Dr. Susan Williams-Lockhart joining us today on the show. We're also going to have our very own sports reporter, sports editor, Sheldon Longley, speaking with us all the way from Tokyo today to discuss Team Bahamas and what's going on there in Tokyo with regards to our Olympians. So, and all of this frustration and all of this heightened concerns, we still have athletes who are abroad doing their best, trying their best to, show up for us, be there for us. And so I'm excited for that episode, that segment. And so I'm looking forward to that as well. So, okay, things that we need to discuss today. I had this question in mind. So there's a lot of things going on just today alone, right? Just today alone, a lot of things are happening. A lot of things are going on in country. We could start off that right now at this moment, BPL is holding a press conference. We all thought it was interesting as media that BPL will wait until close to news time at the end of the day, knowing that this was a situation, there is a situation happening. Reports are that there is a sick out happening at BPL, up to half of the staff out. That is what is being alleged, that folks called in sick, and a press conference then is called on this matter. So, or we think so. And so I'm looking forward to the update for that whilst on air. 1, 2, what has transpired this morning? Of course, you've seen social service workers staging a protest here and in Grand Bahama. The BPSU president, Kimsley Ferguson, sharing and venting the concerns of the social service workers, a group that is, listen, that is something else there. Then also in the paper this morning was a very powerful, interesting article by the central bank governor. Now, there were some other things that was good, talking about the port by the end of the cruise port downtown, allowing us to berth about 250,000 cruise passengers by the end of the year. So that's a good projection if we have that many cruise ship passengers. But something that was said that was interesting by the central bank governor was that of the $2 billion+ that we have in foreign reserves, the usable non-borrowed amount is 350 odd million. So that means that the majority of what we have in foreign reserves has been borrowed to put in our foreign reserves. Ladies and gentlemen, that is concerning. He, who is a very conservative man, I spoke with a well-known economist this morning, and he confirms that Mr. John Roll, Governor John Roll, is a very conservative individual. I think steady, right? Not high or low, and that's what you need with the central bank governor. But he has sounded the alarm that we cannot continue on this track of borrowing to keep the reserves up. So it shows that there is an economic concern that has not gone away. Without all of the talk, the economic concern, the mirage that I spoke of is real. The economic concerns are still very real and heightened. So you have increasing numbers, and hospitalizations are now at 100 persons hospitalized with COVID. We at one point, I think our max bed capacity was at 80 odd beds. It seems as if we've been able to handle that difference. But there is these challenges that are afoot with all that's going on. So you have a health crisis, right? You have a health crisis where COVID is the main facilitator, the main exasperating event that is creating a residual and a continual health crisis, right? So you have that as what is at the doorstep, the consistent health crisis that is affecting our economics as well, right? That is affecting our economics as well. So it gets very interesting on that footing, what is going on there. And so we have, and I see my guest needs the link here, so just give me 1 second. But we have going on now, ladies and gentlemen, where there's consistent pressures, economic, health, labor. Are we a state in disarray? Are we a nation in a state of crisis? That has me concerned. It's as if that no matter how much the government tries to push forward, right? No matter how much they've tried to do certain things, right? No matter how they've tried to do certain things, that as if as every time there's one thing there's a fire. Announcement last night was that they have to postpone or delay the payment of the honorariums. That was a year ago. And that is always concerning when the government can't meet its promises. It's concerning. Trying to implement new taxes to try and capture revenue, knowing that there is no revenue for the Bahamian people in mass, but trying to create tax concessions. The government are we in a state of crisis? That is concerning to me. One fire out, two more come on. And we are in the middle of a health one. That is the catalyst for all of this. And I want to bring on, and I see my guests, someone say, yeah, we're a nation in crisis. Yes, ma'am, we are a nation in crisis. And I, man, look here, the headlines today, the headlines today were not good when Doctors Hospital is saying it's in a mode of crisis. When physicians are telling me, I had a good, someone I consider a close associate tell me that as a physician, that their mother has passed away. So whilst caring for all of our mothers, caring for all of our children, all of our brothers, that whilst they were at work on the front line, they lost their mother. And this is that state of crisis. We've got labor issues. We've got lack of confidence. There's another article today by Jasper Ward. And I think it's also across all of the dailies. I saw it on the Tribune. I saw it on Eyewitness, that there is a lack of confidence in the direction of where we're going, right? The lack of confidence in the direction of where we're going. And I think the first thing that we have to do is approach or look at where we are health-wise. We have to make sure, because there will be a day when this all is gone away. The goal is that you're here for that day when all of this passes. There's an issue of confidence with leadership that isn't changing. That's why I say ring the bell. Let the people have a mandate. Let the people give a mandate. Let the people say, so that we can start over. It's like we need a reset. We need a reset. But I want to bring on a trusted voice. I believe one of the smartest people that I've ever had the honor of meeting, in terms of just her level of teaching, and in a time like this, a calming voice, and one that really helps us to learn more about it. And so I reached out to her this morning, and I see that she's dressed in her work attire. So it shows you just how serious this is. We have none other joining me, Dr. Susan Williams Lockhart. Doc, thank you so much for being on the show.
Doc, how you doing? How you doing?
I'm doing well. I see you're dressed in all of your PPE.
Yeah, ain't no point, because I just came from one, and as soon as I'm done with you, I'm going back. I have 3 or 4 more lined up to go to, right?
Wow.
So I agree with you. We are a nation in crisis right now. When I saw the headline in the Tribune this morning, when Doctors Hospital said that they are approaching capacity to house and ventilate COVID-19 patients, I said, we need to do something. We have to. The wolf is already at the door, and it's late in the day, but at least we still have a chance to do something. Because PMH rang that bell last week, and talking to people at PMH, people on the porch right now, there are no beds. People are being sent home with oxygen levels of 90 and 91. And if you cannot get money to buy oxygen and find somebody to help you put it on, you're going to die. It's simple as that, you know? And so it again becomes a financial game, because if you can cross Collins Avenue and pay $3,000, you may have a chance of going to the doctor's hospital and getting some treatment. But if you do not have that ability, you do not have insurance, and now even with that, they may still turn you away because they were at capacity, approaching capacity from last week. So when the CEO comes on and says to you, listen, we are getting to a point and a place where we can no longer house patients and ventilate patients if they are needed, that is extremely serious. That's
Yeah.
extremely serious. There's no other way to describe it.
Yeah. Doc, that is, and I'm glad that you're saying it, because you have been on the wall, right? About what I think, foreboding and seeing what it is today. For months now, you've been saying, hey, listen, this is serious. Listen, I've been seeing families, but now it's so much so you were expressing to me how serious this is. How, to give us an idea, a picture of what you're
So
seeing
the
on the
picture is
ground.
this, is that so I use myself as my own survey. I'm one solo practitioner. So about a month and a half ago, the things had settled down. We were doing good. They had opened back up. And I said, all right, it's not so bad. And then very slowly, gradually, we started seeing people again. Now the symptoms were different. This time we were having diarrhea and vomiting, okay? And headaches and back pain, not so much. And if your body does not clear, then you got the respiratory situation. So this started about a month and a half, 6 weeks ago, and then gradually it kept inching on and inching on and inching. And I'm like, listen, we went into a problem. When I talk to my other friends who also work in the field, they would tell me the same thing. They say it's starting to increase. And it seemed as if nobody wanted to hear, nobody wanted to know that we needed. That was the time when we still had capacity. That was the time when we still had staff to do something to build it out. Because what I'm saying is, regardless of whether we fall or rise with this, another respiratory virus is coming. That is just the way of the world right now. And so when I'm out in the field, and in this last week, I've seen 17 people. When I say seen, not me, I don't handle 17 of them. But I've gone in homes, they tell me one person is there. And when I go in there, 6 other people come out hacking and coughing. And when we do the rapid antigen test, everybody is positive. You see what I'm saying to you? So when you look at it, between 5 to 6 households, you have this is in the community. These people have not traveled anywhere, right? So we have now the dreaded community spread, which is going to go from person to person, from pillar to post. And, as Dr. Sands was saying, you said Dr. Sands yesterday said 200 people a day. Well,
Yeah,
I
on
trust this
Monday.
judgment, right? 100 people a day. So what are we going to do? He was worked in the ministry, has a very good idea. He was a consultant on PMH for years, still is, has a very good idea as to what the lay of the land is. So if he's saying to everybody 100 a day, you have to take it for
200.
granted. That is what
He's
we're going to have.
predicted that they'll get to 200 a day.
Right. So then what are we going to do? Are we going to wait until it's 200 and the people are falling down like in India? What are we going to do? Because we are exhausted now, right? We on the field, we are exhausted. We're running 12-hour days. And like I had to tell my husband, we basically had to make sure that we took a break so that we did not get exhausted. And some nights I have to tell people I cannot come tonight because I'll be falling asleep on you and I will not make any sensible decision. So this is where we are right now. This is where we are. And I don't think that I'm the only person who is saying that. So what it would seem to me is that there is a disconnect between the people who set policy and the people who are working on the ground. There's a major, massive disconnect, right? Because the people on the ground are the people who are going to tell you, listen, you made this policy. It seemed like a good idea at the time, but it is not working. You need to shift. You need to change. You need to pivot, right? You need to pivot. And it's either you will change with change or you will be changed by change. That's something I heard my pastor Benjamin Smith say. But change is inevitable. It is coming anyhow. Now, what are we going to do? Now, this is not a problem of the FNM government or the PLP government. It's a problem of all of us for years. We have known we needed health capacity and we just haven't built it. We have known that we needed to put in every island a major health center, which was a mini hospital, and instead of flying everybody into Nassau and crowding Nassau up, we needed to send people to those places. We should have one in the South Bahamas, in the North Bahamas, and in the middle, right? We should have had, okay, we don't have that now, but we have to look at both near and far. So further along the road, we have to make plans for that. I hear them planning to put 5 towers in PMH. I'm like, I don't sit at those tables. And with great respect, I say that's wasting money. You need to move and put another facility, maybe on another island or something else at the end of the day. But right now, my feeling about it is this, is that you need to declare a state of emergency. You need to do whatever it is you do to get FEMA, to get the UN, to get the UK, to get whoever it is to come here with oxygen, to come here with tents, to come here with nurses. You need to set up a field hospital either in Kendall Isaac's gym or get a ship, get the Navy ship. You know, America is supposed to be our ally, right? One of our closest allies, and we have been very faithful to them. Now, I don't see no vaccine come from America as yet, but I don't sit at those tables, as I say, so I don't want to prejudge. I'm just describing an observational effect of what is happening, right? But we need to do that and do it now. To do it now, because people, when your major hospitals tell you, nada más, when they tell you we are maxed out, when they tell you that the nurses, when you go in there, nurses ill, the administrator, clerk, and assistants are ill, the doctor's sick. As you say, some people are losing their relatives while they're trying to save other people. It's not a good situation. So what is it going to take? You know, I don't like people dying for stupidity. What is it going to take for us to understand that we need to do something different? As I said, I talk blanketly, I talk with respect because I do not sit at the tables. Maybe there are some other factors that are operational that I do not know anything of. But I could just tell you that when I'm going into the community and finding one person in the house has the PCR done, they're positive. And when you go, everybody in the house spitting and hacking and coughing and having diarrhea, and you run the rapid test on them and they're all positive, you're saying, okay, so what are we going to do? Right? Because not only will they reinfect, they'll pass it, even if the first person gets better and the other people are not treated, they're going to reinfect each other and pass it around and around. And I call this strain the Delta strain. I do not have genetic testing. I do not know, but I call it Delta based on what the symptoms are. And the thing with Delta that we do know is this: Delta magnifies, it multiplies at a very rapid rate. So what they're saying is that the amount of virus in your back of your throat and in the back of your nose with Delta is 1,000 times more than that with the other variants. You see what I'm saying to you? Wow. So this is why it is so transmissible, because when you talk, when you cough, when you sneeze, you are in fact putting virus out there. That's what you're doing, right? So this is why.
So let me make sure I understand what you're saying there. So you're saying with the Delta variant, it is more transmissible because in our throats, it's 1,000 times more what?
You have 1,000 times more of it. It replicates so rapidly. It replicates, it's a rapidly multiplying virus. And so what you're talking about, when people say, you know, is it more virulent? Is it more deadly? Well, it's more deadly because it's going to make you sick because you're going to get it. Before we were seeing people in homes, and COVID-19, 2020, so was it 2019, 2020, was that, you know, one person in the home might be sick, a couple other people might be all right. COVID 2020, one person in the home was ill, very sick with the COVID, a couple other people had it, but they were not bad. COVID 2021, one person in the home gets ill, everybody gets it, and everybody is sick because it is so highly transmissible. And unfortunately, because of economic situations, many people have to live in multi-generational and multi-family households. So you may have one household with 3 different families, 6 or 7 different family members in it, right? That's what you may have. So they are not going to be able to necessarily essentially social distance, right? And Delta is more transmissible, and Delta sticks to the nose and to the mouth much more than the other things do. That's the thing at the end of the time period, you see? So this is why when you see the virus basically overwhelms, it moves with shock and awe, and it overwhelms the body's resistance and body's defenses. And then that's when the people get ill, you see?
There's some words, you said so much in this. If you're just tuning in, Dr. Susan Williams Lockhart, just national expert, and just a blessing to have on the show with us as often and helping as many people that you help on a daily basis, Doc. So thank you. You said state of emergency. That's a serious phrase, state of emergency. But hold on, let's take a break. We're going to take a quick break. When we come back, because I hear you have some challenges in the background, but when we come back, let's have a little chat on it, because I want to talk to you a bit about that idea of the state of emergency. Also, there are questions about ivermectin, Doc, the use of it. And I have a question, and you're talking about the behavior of the Delta variant as well. So I have tons of questions on that, the behavior of it. What is the alpha or the lambda strain? I think this is the new one. It's so many different ones. I can't keep up anymore, Doc. I really can't. So we'll take a quick break. When we come back, let's have that discussion. You're listening to The Hit Back with Nahaja Black, Guardian Radio 96.9 FM. We'll be back right after.
The Hit Back with Naja Black is sponsored by the Cancer Treatment Centers of America, BTC, Bar Retreat and Spa, J.S. Johnson, and Carrie's Fabric and Uniform Store.
Enjoy an elevated mobile experience with BTC, giving you
unlimited talk for the best conversations,
unlimited data for all your online fun,
and unlimited roaming to stay connected while overseas.
For just $50 per line.
Unlock unlimited mobile talk, data, and roaming when you sign up for BTC Superfast Fiber Internet with speed starting at 100 megabits per second. Enjoy more great savings and value. Upgrade or sign up today. Visit any BTC store or btcbahamas.com. Conditions apply.
Girl, Junior just showed me Bella Boy in his phone.
What you mean? He take picture of that good for nothing boy?
Shh, you don't want Bella here. You say that. You know she always say that's my good child.
So what he doing in Junior phone?
Oh, he there because the police looking for him. He on their wanted list.
Wanted persons in your phone now?
Yes, child. And when police want to find anybody quick, after something happen, they can send pictures direct to your phone. Go to Google Play or App Store and search for Crack Crime Bahamas. Then pick install and it will go straight to your phone.
There is also a section on missing persons?
Yes, girl. Everybody needs to get this app so police can tell us right away when these people go missing. Just like an alert system.
Yes, it has numbers for Crime Stoppers Bahamas so you can call and nobody knows it's you. Call directly to Miami and give the information without giving your name or anything about you. I tried the other day and when I hear Junior and his boys talking about where they hide those guns, I walk quick round the corner and call that number.
Call 328-8477 from Nassau or 242-300-8477 from the Family Islands.
Cloth face masks do offer a level of protection against the spread of COVID-19, but only if worn and removed properly and used along with other preventative measures. Your hands should be clean when you put the mask on and when you take it off. Use soap and water or an alcohol-based hand sanitizer. Respiratory droplets from others will stay on the outside of the mask. Do not touch the mask at all once you have it on. Remember, if you touch the front of the mask, the germs will now be on your hands. Remove the mask using the elastic or straps from behind your ears and wash your hands immediately afterwards. If your mask gets dirty or feels damp due to respiratory droplets, change it. Cloth masks should be washed after every use with soap and water. Along with using a face mask, remember to wash your hands regularly. Practice physical distancing 6 feet apart. Avoid touching your face. Disinfect commonly touched objects and surfaces, and stay at home as much as possible. We must each do our part to prevent the spread of COVID-19.
This message brought to you by Bahamas Ministry of Health in conjunction with Guardian Radio.
It's the Hit Back with Naja Black. It's the Hit Back with Naja Black. It's the Hit Back with Naja Black. It's the Hit Back with Naja Black.
And we're back with the Hit Back with Naja Black, Guardian Radio 96.9 FM. Don't forget to follow us on YouTube, youtube.com/c/Naja Black, Naja Black, Facebook.com/Naja Black Show. I want to say a special thank you to all of our great sponsors here. Carrie's Fabric and Uniform Store on Mackey Street is having 20% off sale on all school uniforms and school uniform fabrics. They are now accepting orders to have your uniform skirts custom made. Sale ends this Saturday, July 31st. Call Carrie's Fabric and Uniform Store at 393-0758 for further information. Well, I won't lie to you. I got to run on that. Children still got to go to school. What is going on to school? That's a whole other kettle of fish, but 20% off at Carrie's. Now let's get back to my good doctor and a friend of the show and really one of the smartest people in this pandemic, Dr. Susan Williams Lockhart. Doc, ending on that side of the break, you said state of emergency, that we should really, based on what you're seeing, experiencing, And I think also based on what I heard Dr. Dwayne Sand say even on the show is that looking at about 200 persons, 200 a day, hospitalizations now at 100 at this point, that we need to do something different. And you mentioned the state of emergency. How would that help us?
So I'm not, I may have the wrong term, Nahaja, but there is something that when there's a national disaster that happens, either let's say a hurricane or an earthquake, there's something that the Prime Minister does where he would declare this is a disaster. And that now releases aid from FEMA, from the UN, but there's a protocol that has to be followed. And there's a trigger that has to be pulled. And so my thing is
what we did in Dorian.
Yes, something like that, where you have to say to people, we need help to come because we don't have the things we need right now. And there's no shame in that. Now, I don't know what you call that. I just say state of emergency. That may be the wrong term. I'm not a politician or a public health person, but we are approaching a crisis. If the 2 hospitals are full and we are going to expect a very high level of COVID positive people, if you have 200 a day, many of them are going to want to come to the hospital for treatment. Then what are you going to do? You can't wait until there are no beds or until people are dropping in the road to do something. You have to act proactively. And, as I said, maybe there's a better idea. Maybe there's a plan. There's a protocol, a plan B and a plan C. I don't sit at those tables, so I'm not aware of it. So I'm not dragging anybody. But I'm just saying to my mind, when I sit and I look at what I'm seeing on the ground, I listen to what Dr. Sands says. I'm reading the papers about the hospitals being at capacity. I'm like, okay, this to me certainly seems to qualify for that. And I'm seeing people in homes who, if you have a couple of dollars and you could afford for someone like myself to come and see you and get some oxygen and get some medication, you probably could weather it okay, but many people don't have that capacity. And even right now, we are treating people just trying to give them some advice and some basic medication and writing prescriptions and saying, okay, I can't come back and see you all the time, but try these things and see what works and see what helps, you see? So we have to do 2 things. We have to treat what is here and we have to prevent it from rising. One of the points that was made, and again, many of the physicians made the point, many people who are vaccinated, they can carry it in, because what we are hearing coming back from some of the resorts and some of the places where fully vaccinated tourists are coming is when they do their rapid test, either to go back to the US or the 5-day passport, they're coming up positive. Now, by the time a person with a rapid positive test is in the middle of the Bahamas, they've already been in contact with 10, 15, 20 people. So that now they have taken that and run into the community with it. And this is what. So I think we need to rethink it again and go back and say that we need to test people coming in, vaccinated or not. Canada is getting ready to open the border. I don't know if they're still going to do it, but they were saying you have to be fully vaccinated. You have to have a negative PCR. And I think you have to stay for 5 days in a hotel. They're making sure that you don't put a thing on them, right? Yes. So if they're doing that, then certainly we could, I think, take some prevention. And even if people come at the airport, test them before we lose them into the general population. That's the first point, So, I mean, other than that, the rates keep on rising, and that's one thing. So the second situation is you mentioned about ivermectin. So now it seems as if finally, that people are saying that, okay, maybe all the information on ivermectin was in fact useful, and maybe ivermectin really works. People are coming to that. There's the BIRD study done by the people in the UK, right? And basically speaking, they are showing where many doctors are showing the efficacy of ivermectin in terms of preventing and treatment of COVID. That's one of the things that you have, right? So at the end of the day, what you're finding is that may work for some people, but it may not work for other people as well, right? But ivermectin certainly helps in the first instance by what it does. It may slow the viral replication in the early stages of COVID-19. That's what the science shows. And in the late stages, it may prevent some inflammation, right? But having said that, it is different for everyone. Some people may not tolerate it. Some people may have an allergic reaction to it. It's one of the things that those of us who work in the field, when people were very ill, I would say to them, listen, this is not necessarily proven or approved, but they say, what else you got, doc? I say nothing. And they say, okay, give it to me. And in many cases, people have done better. Now, that does not necessarily prove that ivermectin. I have not done a random controlled double-blind placebo trial on the persons, right? But when you're working in a crisis, you have to use what comes to hand, right? And so essentially too, you have to tell people how to help themselves. The government is going to do what they're going to do, but you have to help people how to help themselves. And I want to talk about a new therapy that was spotlighted by Dr. Juliet Hepburn She runs a site called Luminova. She's a dermatologist. So she was in the habit of using light therapy to treat many different diseases. And this uses photodynamic therapy, which is a laser, and using methylene blue as well also. And what it does, you put it in your mouth and in your nose, and you activate it with the laser. And what it does, it takes the viral load down. It cuts it down very rapidly. And so what we are seeing,
Really?
Yeah, very early results will show that within 4 days to 6 days, sometimes the person would go from being positive to being negative, right, in terms of the PCR. That's one. So very early preliminary results are showing that a formal study has been approved, and she will set that up shortly on. I'm working on the clinical arm of that with her, going out and examining patients. And we actually assess the PCRs to tell you how much virus you have. And what you find is the amount of virus that the person has and the clinical condition correlate very well. But I like this therapy because so far, and again, I'm saying knock on wood, we have not done formal studies. The people that we have given it to have been able to stay out of hospital. And that's the main goal, trying to keep people home. So I tell people to go and look at Luminova, Luminnova, Luminova.com, and research and get in contact, research and send a message and see if that's something that people can use as well. But apart from that, people have to, again, pay attention to their health. So you have to eat right, sleep, exercise, right? I'm not doing any of those things right now. So I put my hand up, right? You have to eat right. You have to drink your fluids, right? Because if you look at it on a vaccine, it's just something that helps to improve your immune system. Then all those things could also be a general vaccines, because all of those things help boost your immune system as well, right? And so this is the thing. So we have to look for solutions that we have in between and among ourselves and at home, right? Because you want to stay out of hospital and keep your relatives out of hospital, because many times the hospital is not able to take you or help you, you see?
Yeah, Dr. Susan Williams-Lockhart. Sorry, Doc, I'm just learning and listening to you. So you, every time you stop, I'm like, okay, I got to ask another question. But this is something here too, Doc. The young are being affected. We had a 26-year-old pass away from COVID-19. One of the things that Dr. Sands said on the show is that we're seeing younger persons succumb to it, and more young people, being admitted into the hospital and having to receive oxygen. Why is this behaving so? Is it the Delta variant that is different? What is the behavior difference here?
Well, I think overall the Delta, as we said, is much more transmissible, number one. And number two, it is there, we call it viral load. The viral load is much higher. Now, someone could be young. It doesn't necessarily mean that they're in the best of health. Normally, young people, they may eat fast food, they may drink a bit, they may smoke a bit, they may party a bit, they may stay up all night. So normally, their body can withstand certain amounts of stressors. But in this situation, as I said, the Delta variant, if you are not 100% in good situation, you are going to be affected. That may be one aspect of it as well, you see? And you see, I think, as well, to a high incidence of it in children also, where it was not happening before with the other people. So just because somebody is young doesn't necessarily mean to say that they're healthy. It just means that they have a higher physiological reserve that normally could protect them from certain diseases. But when the Delta comes and the viral load is so high, it hits and it can take down your defenses very quickly. And you end up...
Oh, did we lose Doc? Okay. I think we're having some slight technical issue. Okay, you're back, Doc.
Yeah.
Can you hear me?
So, Ms. Black, you see, this is the situation that we're dealing with. So what I'm saying to tell people is, young people, especially when they got, people think, okay, we got the vaccine and the vaccine is like a Kevlar vest. The vaccine is like a Kevlar vest that's going to protect you. No, the vaccine provides a level of health to you. And your response to a vaccine and my response to a vaccine may be different based on what our immune system is like. If my immune system is very strong, the vaccine is going to work to help build up a tougher protective wall. If your immune system is very weak, the vaccine will build a wall which is a little bit less. And so you may still be at more risk than I am. Vaccine is not the same thing for everybody. It's not a Kevlar vest that just coats you and covers you. You see what I'm saying? Yeah. So we still, I think many people, when they got the vaccine, they went wild. It was like the Indians gone wild. Yeah. They ran outside and they were like, let's party, let's go in the hookah, let's party on the beach, we don't have to wear no mask, oh glory, hallelujah, let's go. Right? This is what they did. And I think we are finding now that the guidance from CDC is suggesting that people who are vaccinated need to wear a mask indoors. They were saying, first of all, no. right? So the same old tried and true things happen. Number one, you have to wear your mask, sanitize, and keep social distance from people who you do not live with. Do not be around people you do not live with without a mask and hugging up to them and other things like that, even if it's your family. And this is a hard time for families, a very difficult time for families as well,
Yeah.
But you have to do these things to keep yourself safe. You see what I'm saying? You have to do it.
Symptoms. I think has the symptom or the behavior of COVID changed? What are some of the symptoms of COVID-19, or is it that each strain, each variant has a different behavior?
Well, what I think actually happens here is that I think the strains are a bit different, because the first COVID was basically upper respiratory. You got like the sore throat, the stuffy nose, you got the coughing, you got that early, right? And then you might get the other things. The second COVID came with headaches, muscle pain, fever, and then some respiratory. This brand, whenever anybody calls me and they say, I think I ate something bad, I'm having diarrhea and vomiting, my body's achy, and they would insist, that they have food poisoning. I'll say, no, it's COVID you have. I'd say, no, it's COVID you have. It's COVID you have. And 9 times out of 10, it will be, right?
Wow.
So as I said, I do not have a genetic testing. I know we're trying to get that so that we can test it and see what actually is the genomic pattern and which strain it is. But when you see many people presenting in the same way, I'm like, okay, this is the same strain, because the presentation of the human body is the same. You see what I'm saying?
Someone had a question for you. Have you seen the data on the positivity rates of tourists that are leaving the country? Have you seen any data on that? On folks who are fully vaccinated? Have you seen the data on that, Doc?
Well, I know what you mean. You're asking about the data on people who are vaccinated and getting the COVID?
And leaving the country. So this is for tourists. So any tourists or guests that are coming in country who are, have you seen that data of tourists who are leaving the country who end up positive?
Well, I have not seen the data, but I know from talking to people anecdotally that is in fact happening. Now, the thing about it is that you have to go through a system, and surveillance unit is the one who tracks and puts that in a report. Surveillance is totally and completely overwhelmed right now. It is. And they do a great job with the resources they have. No shame on them. But you only could do what you can do, right? But I'm hearing from friends, I have not tested anyone who is positive leaving the country. But I'm hearing from my lab technicians and people who test for hotels and other places that, yeah, you're getting 1 or 2 positives out of every batch of people who have come in the country fully vaccinated and getting ready to go back to the USA. And there they are positive they have a positive rapid antigen test. That's the thing, right? So this is it. I also want to make a point to say that in many cases, many people are symptomatic, right? Symptomatic, but the rapid test is negative. We are seeing that as well too. So we are coming to a point and place where we tell people, if you say you walk like a duck, you talk like a duck, you're a duck. So if you're having vomiting and diarrhea, you're feeling badly, all these other types of things like that, you likely have COVID, regardless of what the rapid test is. Now, the issue is that a PCR test is about 5 times the cost of a rapid. Many people in this day and age don't have the money to run a PCR test. It's about 100 to 135, I think, you can get it for. Many people don't have the money to do that, so they're not proceeding on to PCR testing, and they're saying, well, my rapid test was negative, I'm good. And the answer is no, it's not like that. And it may have to do again with the variant and with the strain that we have, you see? So this is one of the things. So I think people, you have to just be very careful with everybody, because how do you know who's vaccinated and who is not? You don't, right? And vaccinated people can transmit and can get COVID as well. They can do it, you see?
Dr. Susan Williams-Lockhart, do you think that we should do more testing, Doc? What sort of, what are you hoping to hear? I think that would be my question. What are you hoping to hear tonight that might be able to help the physicians, nurses on the ground, healthcare workers that you hope can help you guys get this out of control? Should we do a lockdown? What should we be doing?
I think we should be testing much more frequently. I think we should make testing free. I think the cost of paying for a PCR test at $120 is a lot cheaper. The cost of having someone in intensive care is $5,000 a day, right? For nursing and bed and everything else like that. So when you do the maths, it's a lot easier. I think PCR should be made free. And you tell people, the government should pay for it. And you tell people, everybody who wants to get tested, let's come and test you. So that way you will be able to isolate who is ill. and keep them in one area. I remember a friend of mine lived in Jamaica, and he was living somewhere, I think, in Bull Bay up at the top. Jamaica closed down that whole district. They actually put a bar across the entrance in and out and let nobody go into there and come out of there for a month. That's what they did. They locked the areas down. So if you find that there's a lot in one area, I'm not saying you necessarily do that, but at least you will know what you are dealing with. And you have to go in and talk to people and tell them, stop moving. You see, this is the thing. So I'm hoping that you will hear that there is going to be some sort of facility that even if it's only a rapid antigen test, I'd like a PCR that there will be some facility made for more testing. And to help people just don't have the money right now, Miss Black. They're people hurting, many people, right? So that's the first thing. I hope also to hear that you're going to institute testing for people coming into the country. If people have to test to go back into the USA, why should they not have to test to come here? We are no worse than them or lesser than them. That's what I feel. That's the second thing I hope that we'll hear. And thirdly, a plan to get more resources, beds and staff. What they tell me, I gather, is that there may be beds. Some beds will be available, but a bed is no good if you don't have a nurse or a doctor to man it. And this is one of the issues that they're having because many of the nurses are getting ill. You see? So you need to get a situation where you're going to expand and augment your very rapidly. So some either you're going to send out for help, you're going to send out for people to come, right? I don't know where and how, but as I said, there are ways in which that can certainly be done. Thirdly, I would hope that we will talk about and have a real discussion about some of the alternative vaccines. I gathered that people were telling me that some AstraZeneca came into the country yesterday. I believe they said it did. I don't know how many doses. But remember now, vaccine is like chicken. We don't like one type of chicken, right? AstraZeneca and Pfizer and Moderna are the new iPhone ones, right? And some people like their flip phone and their little bubbler, right? The Sinopharm and Sinovac, which are the Chinese vaccines, which I believe are accessible to us. Certainly Jamaica and Barbados and Trinidad use those vaccines, right? The Sinovac and Sinopharm, I think, is accessible to us. Let's use it. Many people who will not take the new vaccines will take that. Also, I say to people, Cuba has a vaccine that seems to be working very well for them. They made a vaccine that doesn't go into the cells. It's a very innovative technology that they're using. So they're in the region, so I don't see why should we starve in the midst of plenty. We have people who could give us vaccines. Maybe the USA, I think even with the best intentions in the world, they may not have much to release now because they have their own problems. You see what I'm saying to you? Yeah. And I always tell people, I remember when in the first wave, when we were waiting for PPE and the US, the ships were actually to the Bahamas dock, and then order came to turn around and they gave every supplier back their money and said, we can't let you have this PPE, we need it for ourselves. And I'm saying, well, if they would not let us have PPE, are they going to let us have vaccines? I don't think so. I could be wrong. As I said, I do not sit at those tables. I don't. But I'm hoping that we will have that discussion. And, as I said, I can talk tongue-in-cheek because I'm not a politician. I don't set foreign policy. I'm just on the ground as a simple physician trying to keep people. Because you see, until we conquer COVID, nothing else moves. There's no elective surgery. We can't do our clinics. We can't do the things we need to do. Because COVID is an all-consuming entity. And we need to defeat it before we can go back to having some sort of normalcy, or at least find a way of putting it under control. I do not think COVID is going to leave us. It is going to come in different forms. I'm concerned because normally in winter time, it gets worse with the cold, right? So if this is where we are in summer, I'm concerned about what happens in the winter time. So we need to be making plans and strategies, not just today for tomorrow, but a plan that says, okay, we know what we need, right? The people in Wuhan, China built a hospital in 10 days. Some of the Chinese are here. Why not ask them? That's my thought on it. So as I said, I talk tongue in cheek because I don't know the pressures. I'm not sitting at that administrative level. I'm just free thinking and saying these are the things that would make sense to me. So I hope that at least some of those points are addressed. That's the thing.
No, it was, and brilliant points there too. One of the things you've mentioned, Dr. Todd, is movement. You say go out, get some sunshine, exercise. How important is movement? How important is that mobility to combating COVID if you are?
People need to move and exercise, certainly. I think that's very important because when you move and exercise, you build up your immunoglobulins, you build up your, you're going to build up your encapsulins and your endorphins and your feel-good chemicals, which all are going to boost your immune system. So that's very important. Now, movement, though, has to be carefully categorized because what's happening, COVID doesn't move itself, people move COVID. And so what we are seeing is that people are moving inappropriately. So he may have to also talk about a period of locking down, to at least try to give the healthcare system a chance to recover and get itself on its feet. Because if you put people in places where they're not able to move, because, you know, we'll be locked down from 10 o'clock now, but COVID is not being spread between 10 and 11, Ms. Black, as we discussed. I think COVID is being spread when people go to the food store, they go to the grocery, they go to the gas station, when they're on the job, when they're interacting with each other. That's when I think it's being spread, to be honest with you. So that is some attempt to stop the movement. Yes, it is. But, you know, I think you have to be realistic as well, too, in terms of what is happening. And that's the thing, you know. But as I said, I do not sit at those tables. I know my friends in the ministry are very tired. They're exhausted, I think, trying to deal with it. Nobody thought this would happen. You know, when you look out, and I heard you talking about what we have to do here, but many people in the world are in a similar situation, bigger countries with more resources than we do. That's the issue too. They have deeper pockets than we do. We don't have the deep pockets to necessarily be able to fund all the things that we need, but what we can do, we should, you know? And I know that there are mechanisms of getting funding and resources from international organizations. And I don't know what it is, but I know they do exist. And maybe we should take a look at those. That's the thing.
Yes, yes. And you're right. I mean, listen, the world is going through its own challenges with COVID-19. And I think that what you've shared here today, Doc, and when you're talking about ivermectin, you're talking about the Delta variant and its behavior, you know, free testing, all of these things are important to us. And as we go to a break, and I know you have to get back to work and dealing with patients, express to my audience, if you can, Doc, the seriousness of the condition where we are and what we can do to really protect ourselves and each other.
I would tell people this is a level 5. You know, if you have 0 to 1, this is a level red alert. I would tell people, one thing I notice when I go into homes, parents like to lock up, especially when they feel sick. They like to lock up at the house and make a heating situation. That's one of the worst things you can do. COVID is a respiratory illness, so everyone should have their houses open, ventilation blowing through. That's one thing. The second thing is wear your mask properly. One of my patients I know was in the habit of wearing his mask under his nose, right? And so when he went by people, he got the COVID and he got it from someone and he spread it to a couple of people as well. Wear your mask properly and pay attention and really and truly do your best to stay away, not to be in contact with people that you do not live with, you know? Try your best even at work. You know, people, they tend to get careless, they're vaccinated, they don't put on their mask, you know, they feel a sense of relaxation because you've opened back up the country. But you still have to be vigilant and you still have to be aware. You must eat properly. You must take your vitamins and supplements, right? You must drink your water. Coming to the beach, I'm on the beach right now. Taking a swim in the beach is great. You salt water to the eyes, the nose, you know, the throat, right? Excellent, right? That really helps, you know. But you can't be partying and clicking along with that. You cannot do it. So people I know, some people just got tired and said, man, whatever happened. But it's not just you. It's your Grammy and your mommy and many other people that could be affected and impacted as well, you know. So I would just tell people, you know, hang tight and we will get through it, you know. I think we will get through it, but we have to look for systems and solutions that are native to us. We can't look for something else that somebody else is using. We have to look for solutions and systems which are ones that can be used by the Bahamian people. And I think that's the thing. And I know Bahamians don't like people telling them what to do. You have to engage people in a discussion and draw them in. Get the community leaders and say, listen, right? Tell Pookie he always out. He live in Black Village, but every night we see him out in out McCullough Corner. Tell Pookie stop moving like that because he either going to carry the disease or bring it back in Black Village. We don't want that, right? Yeah. So therefore, people have to become their brother's keeper and do the things that they need to do in order to be in good shape.
Yeah, Dr. Susan Williams, Lockhart Doc, I thank you so much. I appreciate you. Please be safe. I see that you're fully regaled and your PPEs. Be safe. I know you are helping folks going to their homes. So thank you for your service, but be safe yourself. And you have a lovely family and they need you to be able to come home.
Oh yeah, Ms. Black, I told you I plan to be 72. I'm going to get my bikini body ready and I'm going to be on the beach in one purple bikini at 72. The pink sand beach in Lucha. That's my plan. So don't worry, I'm going to be around for it. Definitely. Good. Anyway, take care of yourself and thank you for the work that you do to tell people and inform as well. Take care.
Thank you. Thank you so much. Dr. Susan Williams, Lockhart, everyone. I think that was a lot of very important and useful information. I mean, wow. Can I just say thank you for Dr. Susan Williams Lockhart for being that voice of reason, bringing the data, being very candid with the truth of it. What do we need to do? We need to have more testing. I love that she mentioned the analogy or created this connection or relationship, correlation, that word is the one, where it's cheaper to pay for a PCR test than an ICU visit. That's a powerful correlation. We need to do more testing. We need to, do whatever it needs to be done to bring assistance to our nurses and doctors and persons who are in the healthcare facility, man, because I am growing daily more and more concerned. Voices like Dr. Lockhart, voices like Dr. Millicent Bassett, voices like Sabrique Butler-Pinda, voices that are all around saying that we need more help, that this is what's going on the ground. Ladies and gentlemen, please take this thing seriously. Take care of yourself so that we don't, we make it past this. And if you're vaccinated, please behave like you're not vaccinated. I have a problem with that too. People who are vaccinated, listen, you just throw in party and everybody mask off. That's fun times. But you can't do that right now. We're still able to give this thing away. You can catch it. You're still able to give it away. A lot of vaccinated people are giving this thing away as an unwanted gift. We're going to take a quick break. When we come back, let's talk a bit more. We got a lot of other things to hit on, but just want you guys to stay focused. Keep your mind on that. We are in a state, I believe, in a state of crisis on a lot of fronts. And this one in particular, we've got to get our healthcare situation in order. You're listening to The Hit Back with Nahaja Black, Guardian Radio. We'll be back after.
This is Guardian Radio, 96.9 FM, Nassau, Bahamas.
You're listening to the Guardian News Network. Good afternoon, everyone. I'm Taylor Ferguson. Here's what's making news. Thank you so much for tuning in. More than 200 Bahamas Power and Light employees called in sick today. BPL executives are holding a press conference at this hour to discuss a number of issues, including an update on a new industrial agreement. Department of Social Services offices across the country shut down for an hour today as employees used their lunch break to protest government's failure to address a myriad of concerns. Union leaders say they're prepared to up the ante if those issues aren't addressed within the next 7 days.
Firstly, there are health concerns resulting from the COVID-19 pandemic. Given the large volume of persons that they must serve on a daily basis, but they have no health insurance or risk allowance. The government must determine whether social service employees are essential workers.
The Ministry of Health confirming 130 new COVID-19 cases in addition to one death on Bimini. A 58-year-old man on Bimini reportedly died on July 28th, bringing the total number of deaths in the country to 286. Officials say 27 deaths are under investigation. Hospitalizations once again hitting triple digits. 100 COVID cases now in hospital, 10 of them in the intensive care unit. PLP leader Philip Davis slamming the Minnis administration's management of the pandemic. Davis says the country is facing a public health emergency, but its leaders are shooting from the hip. That's what's making news. I'm Taylor Ferguson. AP News is coming up next.
Infrastructure. I'm Tim McGuire with an AP News Minute. The bipartisan group of senators negotiating the $1 trillion infrastructure plan have a deal. Ohio Republican Rob Portman.
We now have an agreement on the major issues. We are prepared to move forward.
Senate Majority Leader Chuck Schumer says a test vote is possible.
Tonight, I'm intending to call a vote to move to proceed to the bipartisan infrastructure bill. I believe we have the votes for that.
10 Republicans have to join with the 50 Democrats to move the measure forward. The CDC recommends people, including those who have been vaccinated, to wear masks indoors, including students and teachers in schools. The advisory aimed at counties and states where the coronavirus has surged, mainly because of poor vaccination rates in those areas.
Please, 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 if you're not vaccinated, protect yourself and the children out there. It's important.
President Biden while touring a truck plant in Pennsylvania. I'm Tim McGuire.
is Guardian Radio 96.9 FM. Fresh news, smart talk, all day.
In life, there are always challenges. Today, we find ourselves having to be more self-sufficient, socially aware, and technically savvy. At J.S. Johnson, we are committed to our customers by providing cost-effective insurance solutions. No matter what your insurance needs, we will always be here for you. Call 397-2100 or visit jsjohnson.com. J.S. Johnson Insurance Agents and Brokers, giving you peace of mind.
When I had got prostate cancer, my family didn't know if I was going to live. At Cancer Treatment Centers of America, within days, I got an appointment. They presented me with treatment options, and we set up a robotic prostatectomy. When my scans came back, there are no signs of cancer. They don't see you as a number, they see you as a part of the family. I'm going on with my life. It's a real gift.
Call us at Cancer Treatment Centers of America.
You have to be strong in today's world. Keep your focus and what you believe in, how to achieve all your dreams. Keep moving forward. Never accept less than who you are. It's the hit back with the hash of black. It's the hit back with the hash of black. It's the hit back with the hash of black. It's the hit back with the hash of black.
And we're back. Good afternoon, everyone. Welcome back to the Hit Back with Nahaja Black, Guardian Radio 96.9 FM. If you've missed any part of the show, you've missed too much. Dr. Susan Williams Lockhart just really giving us a lot of information here, really just sharing a lot of information. Ventilate, open up the windows in your homes. That's something that she said that to me earlier today, and I was like, I'm on it. Ventilate, open the windows in your homes. Wear your masks properly. This is one of those things that I've been hearing nurses and physicians, healthcare professionals say, please, I know it's a nuisance. I cannot wait till we get back to real life when COVID is not the foremost thought and where we are not having to wear masks. But right now it is what it is. And so please wear your mask when you're out in public. It is affecting younger persons differently now. It's hitting differently. And maybe because it is that viral load, like Doc said. Something interesting she said with the Delta variant, man, is that it is 1,000 times more virulent, right? And so it's like in your throat. And so when you speak, it's more contagious. That's messed up. I don't want anybody to talk to me. And I speak for a living. I'm not interested. I don't want to do it. I don't want to do it. I don't want to do it. Want to say something. So there's some breaking news. I just got something interesting in my phone with regard to the Crystal Serenity. They're adding a new stop, and the stop is in Miami. What does that mean for we're still home porting or, embarking here. So there's still that home porting here. But what does that do? Does that change the income variations there? But we got that to discuss. I want to remind everyone, Carrie's Fabric and Uniform Store on Mackey Street is having a 20% off sale on all school uniforms and school uniform fabrics. They are now accepting orders to have your uniform skirts custom made. Those uniform jumpers as well. Sale ends this Saturday, July 31st. Call Carrie's Fabric and Uniform Store at 393-0578. That's 393-0758. Sorry, 393-0758. So 20% off sale on all school uniforms and uniform fabrics. So please call them, prep. I think that we have the back to school holiday, tax holiday. So that's something there. So everyone, I want you all to be safe with that. So there was a question that I asked at the beginning of the show, and this is, whilst we're dealing with this, COVID is just the most dominant conversation, right? Most dominant conversation that is before us. And I am so right. This will not get better until we as a people become more responsible. And I'm with you. Everyone must take personal responsibility, man. You can't be wilding out. We can't be partying. Like you got to know that at a certain point that this is reckless, that we all want to someone say they can't live up in a closed up house. Man, listen, it's so powerful, man. But you're right. I have to open the windows. But we all have to, be accountable and take responsibility. If we can do something to help the economy by getting COVID under control, then we must. And then there's some irresponsible things you say, right? Like leadership matters. And I will always go back to that. I can't rest on my laurels on that position. I think that, you have to know how important the narrative is and why you must be consistent with the narrative, not just test it, not just, social distance. You've got to be a little bit more intentional with the pictures and the words and the entire narrative you're bringing forward. So it is one of those things where I do lay blame on lack of leadership to where we are. Because I think that, I love that there were certain things that we did right, especially in that first encounter, that we did right. And then after that, everything started to go wrong. Right after that, then July last year, all hell broke loose. And here we are, July 2021, and all hell is breaking loose again. C'est la vie. But on top of that, ladies and gentlemen, now we continue with more things. Like, it just can't deal with one thing. One thing just ain't enough for us. One thing is just not enough for this administration. They've got to get all kinds of other stuff. This is why I said we must be a state in disarray and a nation in crisis, because now you have problems that are not just one problem, right? Crisis is one thing. When everything is just impeding your next step, when you feel things feel insurmountable and events just keep coming, stopping you from processing and able to cope. And I feel like that's where a lot of these things are. And if I were the government, I would feel as if every time you try to out of fire, another one comes. So today, and this is an issue of labor that has been going on throughout this administration's tenure. So I think it's fascinating when people say it's election year and you're going to have this. This has been an issue with this administration where the theme of lack of respect has come through every union. And I always say, well, what was promised to each union, so that every union now is frustrated and upset. But every union has had an issue under this administration. There are how many issues of strikes that have been, loopholes created, or not created, but used so that the junior doctors couldn't strike. There was even an attack or a plan where we tried to vilify junior doctors, saying, I went to school for this thing. I want to learn this thing. It is a skill set that can't be found around the corner. Respect me by paying me just what you owe me. And we started to vilify them. I stand in solidarity with the junior doctors, because today you need those doctors, right? You need them. We're begging for PHA to bring more of them on. We're begging for PHA to bring more of the nurses on. You got to know who to take care of in a system, in a society, because when you need them, you need them. But we digress. So today now we have, surprise, I didn't see this coming. I didn't. And maybe that's because, all of this is going on. So today, social services workers said enough was enough today. And they wanted, folks to know that they're tired, right? So they're frustrated. They've not been paid what they've been owed. They feel as if there's a lack of respect present the way they've been treated. And so it's become, a need for them to come out and say, we're on the front line. We were there for Dorian. We were on the front line of this pandemic. We're here every day working, and we're not getting any respect. So I had, today, Bethany McDermott went down and spoke with, and this was on their lunch break, right? Protesting. The workers are protesting this issue. And I want you to hear this clip from the BPSU president, Kimsley Ferguson.
The staff at the Department of Social Service has some long-standing issues they wish the government to address. Firstly, there are health concerns resulting from the COVID-19 pandemic. Given the large volume of persons that they must serve on a daily basis, but they have no health insurance or risk allowance. The government must determine whether social service employees are essential workers. Currently, it is left to their discretion. that places the staff at a disadvantage, as they are non-essential when honorariums are being distributed, but essential when there's a hurricane or any other disaster. Unlike some government departments, the department remained open during the entire pandemic despite the health risks to employees. Little concern was given to their well-being. They are expected to simply soldier on. These workers, however, have been long-suffering, as half of the staff is temporary and many persons with good records and qualifications also suffer, overlooked for promotions. The staff feel abandoned, overlooked and forgotten, as the government has found the wherewithal to address outstanding matters in other ministries, while they have been ignored by successive governments. There is little upward mobility, leaving many trapped at the bottom, and a managerial staff seemingly oblivious to the concerns and needs of the staff. Below are some of the issues. And so today we are addressing the fact that social workers, support staff, work programmers at the Ministry of Social Services are concerned that, one, they've been working for countless years and they have never received increments. When the government issued general increases, these work programmers do not benefit from it. And so these individuals who carry the full caseload of case aid workers and social workers who are deemed work programmers are not being fairly dealt with. And so today we have gathered ourselves across the length and breadth of this Bahama land. Every social work office or department or ministry or section has taken the opportunity on their lunch hour to make an appeal to the government of the Bahamas to address the outstanding concerns in relation to social workers and those disadvantaged staff that are deemed work programmers. The work programmers are those individuals that are carrying an extreme caseload and are addressing issues that full-fledged substantive social workers would be addressing. There is also the issues of promotions in relation to social service. We would have met with the permanent secretary at the Ministry of Social Services initially during the month of January, where we asked them if they could update us in relation to the regularization exercise. We discovered that they did absolutely nothing. During the budget debate, I had a discussion with the Minister of the Public Service, Mr. Brensel Road, who advised that the Ministry of Social Services and the Minister of Social Services forwarded nothing in relation to regularizing those temporary staff at the Department of Social Services. We met with them afterwards, and we had asked if we can be given a further update. We were advised that there was a team assembled at Social Services along with persons from the Ministry of Public Service who were working feverishly in this particular regard. Hence, we are not satisfied because we want to cause them to take a look at the fact that every other ministry in the public service was apprised that there was a regularization exercise going on from 2016. We need to understand why is it that the Minister of Social Services and the Ministry of Social Services are derelict and delinquent in their duties in relation to these individuals that stand behind me. And so we are saying to the government of the Bahamas that social workers will tolerate no more mistreatment and abuse while being required to serve the public during the course of any natural disaster that would take place in this country. In my view and in their view, these individuals are essential workers in this country, should be considered for honorarium that's being given, should be considered for insurance, should be considered for hazard pay. And so we are going to stand in solidarity across the length and breadth of this country until such time as the government, with their dismissive attitudes, pay attention to the concerns of the workers in this country.
Well, as you heard, and my apologies, technical issue there, that was Kingsley Ferguson, president of the BPSU, right? And he's sharing his concerns there. This is what, now this is that, right? So I'm like, a part of me, there's this, oh my God, this is happening now. But on top of that, ladies and gentlemen, there is talk that quite a large set of staff at Bahamas Power and Light have done a sick out, right? That they're calling in sick. And now the pressure is on, right? The vice grips are on. The administration is trying to deal with a economic issue, right? Where we have a health issue and an economic issue that is tied together, right? That one is causing the other to metastasize into a glaring issue. And this morning I felt for this. I really did. I did feel for this administration this morning. I really did. It's like, no matter, there is no, how are they handling this? I'm curious as to what is going on in the meetings. I'm curious as to, because just last night they had to, do an about face or to make a statement before it became an issue where the nurses would complain or, say, hey, listen, you promised government payday. And I got something from someone. I have something from someone who sent me a great message, who's a social worker. Just wanted you to know that civil servants have not gotten their increments that has been owed to them over the past 2 years, right? However, doctors, nurses, and police officers got their increments and monies owed to them. Nothing was on our pay this month, and today is government payday. So this is where this is the situation across the board. And man, this is I'm stuttering here because I'm asking, are we in a state of crisis? Are we in a state of crisis where there will always be that other shoe, right? That other shoe. And I see I'm getting, my text messages are finally coming through for Dr. Lockhart. And I'm so sorry, guys, they weren't coming through earlier, whilst we were online, and just coming through right now. Someone says, I have a situation. Yeah. Okay, so there's some interesting things here. But where I'm concerned is, are we in a state of crisis? You have the economic crisis. You have an economic system right now that is very fragile. Can we afford another lockdown? Is that something that we can afford? But can we afford to not do something that will stem the tide of the increased cases? As long as the doctors get it. Doctors Hospital says they are in crisis mode. People don't want to go into Doctors Hospital for the amount of people that are coughing in there. Same thing with, we saw the videos of the porch there in the PMH. So we know that there are things going on in both major facilities. We've had nurses pass away. We've had, other health staff, the young York family, mother and son. So we are in a, someone says, no, we're not in a state of crisis. Unions are just being smart to push the government in the corner. But that is true. And that is strategy, right? I think everybody, if what is the story we say? Listen, if a politician come and offer you $50, take the $50 and still vote for what is right, right? If you're fool enough to put money in my hand, I still go vote you in or out. No, I don't know what to do with you because I am going to vote right. And if that's what people are going to do, I think people, you use the vice grip of the leverage when you get it. And that's why I always thought it was sad that, physicians and doctors, physicians and nurses have leverage. They're needed. Their compassion is what is used, especially our doctors. Their compassion is what is used against them, right? Because they take their oath seriously to do no harm. They really do take it seriously. Do we need some better healthcare? Yes, we do. There is that leverage moment. You use your leverage, but it's not just that concerns me. It also is that I'm reading in the paper today that the Governor General says that the only usable unborrowed funds in terms of our foreign reserve is $369 million. And now we're propping up our foreign reserves through lending. And he's saying that, hey, listen, this is not sustainable. Other economists are saying that this is not sustainable. we're basing a lot of our revenue, and I haven't heard anyone in government deny that what has been projected as a 2024 recovery is not going to happen. That's the curve. And 2024 being at 2019 sort of numbers. Have we surpassed that? Are we now hopeful that 2019 economy numbers are, better? Like we're going in the right direction. Listen, we are trending in the right direction. Thank God for home porting. Thank God for all of the vessels that are coming in, and the opportunities are for yachting. But then we have guests who are coming in not vaccinated, so it's a double-edged sword. So we're excited that people are coming in, because that's for hotels. Is it trickling down to other folks? We don't know yet. We haven't gotten those numbers. But it's revenue for the hotels. We know that when they come in, folks aren't getting PCR tests. So it's a double edge. We want the money, but to what cost? So then it's, again, is the health and the economy clashing on purpose? So can we afford to lock down? And can we afford not to lock down if the healthcare is in crisis? I don't know what to do. This is one of those things where I would love to know what the government will decide to do in this. Because if we are to the place where Doctors Hospital is saying they can't take any more, it's just saying that there's no room in the end, we are sending people home as to a standard that is not normally the standard in terms of oxygen saturation levels. And if you have money, you can get oxygen to your bedside. Listen, let me tell you. Dr. Williams-Lockhart came into a family home, had my family with oxygen and medication, and she stayed by their bedside for hours. We paid for that. And I'll tell you, that set us a ticket, a nugget. But we had it to pay for, right? Because you had to get all kinds of things that I didn't know you need. And then they still ended up in the hospital, right? Because it was just, we couldn't stop the trend. They couldn't stop. And this was after they were sent home from the hospital to go through that process and then to be sent back to the hospital. This I tell you, this, for me, I don't play with this. This is serious for me. So my point is that it is not, there are a lot of people, if we don't get this thing under control, who will die just because they don't have the resources, because the hospital is overrun. Someone said it's right, it's a catch-22. Do we let them in for the revenue? But knowing if we let them in the way we are putting people at risk. We have 5 immigration officers based on sources, just from LPIA, just from the airport, out with COVID. 5. That's at the front line. These are all frontline workers. And I want you to get that. Frontline workers is anyone who has to deal with anyone because of their job right at this point. Anyone who got to be to work is a frontline worker, especially those who are dealing with persons at point of entry. Because that's where the variant had to come from, through point of entry. If it wasn't in country and we live on an island, it had to come in to the country. So I think that there's, the Prime Minister's speech is going to be one that I will listen to tonight, because I'm very curious as to what will be the options that he presents. How does he protect the citizenry, the people that he says that he loves and he wants to make sure that we live? How does he protect us? He also has the weight of the business community saying you can't lock down. And, persons who need the money, who are risking COVID because there's no other income. You don't have money saved in the bank. You don't have that save. You don't have the option of, if the economy is shut down, you can live or you can eat. People don't have that option. There are brothers and sisters here today struggling to find money just to feed themselves and their children today, right now. And what is being provided is insufficient. So this is really tough decision making, and you don't make light of it. Where my criticism comes is that this was tough decision making that should have already been, a lot of situations should have already had contingencies, resolutions, a line where we say, when we cross this threshold, this thing happens. And when this happens, this is activated, so that we are seeing into the future, but we're always seemingly surprised. COVID seems to always be catching us off guard, right? Like I said, everything is a shock. Oh my God, if you lose an extra 100 people, we need to have a press conference. What? That's where my issue comes. We're always shocked. Don't be shocked. Don't be shocked. Be proactive. Lead with foresight. You got the data. The World Health Organization is sitting at the table with you. Pan American Health Organization is sitting at the table with you. Health officials are sitting at the table with you. Get more competent health officials if you need them. And not yes men and yes women. Get those who will push back and say, that ain't a good idea, chief. Don't keep capitulating. Stand firm on something, right? Stand firm on it, right? There are so many challenges afoot. Someone says, Naja, I agree with the union leaders because excessive administrations have not valued its citizens and the workforce. They have been partial and some discriminatory. They've allowed large private employers to exploit its workers contrary to the labor laws of the Bahamas. Oh, and on that point, which is so interesting, the point that the texter made, I think we've kind of abdicated our responsibility to the labor laws, right? Like abdicated our responsibility to labor during this tenure of COVID, because we've allowed employers to make decisions on what normally labor would be dealing with, right? I'm curious as to this, where we've said, okay, you want to furlough everybody for extended period of time, no problem. We'll just give you rights. And if you want to make sure that people are vaccinated, we won't step in. Let the employer decide what the rules are at work. That's an interesting process there too. Someone says the problem is that they're sitting at the wrong table. Yeah, the smart ones are sitting at the wrong table, or maybe our leaders are sitting at someone else's table. But we've got to pay attention to this. We've got to stay ahead of this, and you've got to plan. I don't know what the PM is going to say, but whilst all of this is happening, ladies and gentlemen, guess what's also going on? The Olympics. Our athletes are out there, and I don't think many of us are feeling Olympic-y, but our athletes are out there doing their thing. So when we come back, Sheldon Longley, senior editor of sports editor for The Guardian, will be live with us from Tokyo. So happy that he's doing this. It'll be 6:30 a.m. tomorrow for him. So we'll be back after this. You're listening to the Hit Back with Nahaja Black, Guardian Radio 96.9 FM. We'll be back.
Tired of banks forcing you to use technology to bank the way they want you to? Your convenience is important. So no matter what your banking needs, Commonwealth Bank's friendly staff are always available in branch for that personal one-on-one service. But when you choose technology, our online and mobile banking app offers you state-of-the-art functionality. The choice is yours. Commonwealth Bank. Bank the way you want.
Rejuvenate, refresh, treat yourself. Immerse yourself in total comfort. Pamper yourself. After all, you're worth it. Relax. Rid yourself of all life's stresses. At Baja Retreat Anti-Aging Spa, you will find everything you need to enhance your body and spirit. Call today at 323-6711 and begin your journey to serenity at Baja Retreat Anti-Aging Spa.
The novel coronavirus disease, now called COVID-19, is a new strain of coronavirus that has not infected humans before. Symptoms include cough, fever, sore throat, breathing problems, and shortness of breath. After a person has been exposed to COVID-19, symptoms can appear between 2 to 14 days later. Severe cases can lead to pneumonia, severe respiratory syndrome, kidney failure, or even death. The virus is transmitted after being in close contact with an infected person. To prevent the spread of a respiratory illness like COVID-19, wash your hands for at least 20 seconds with soap and water. Rinse, then dry. Avoid touching your eyes, nose, or mouth unnecessarily, especially if your hands are not washed. Cover your mouth and nose with your inner elbow or tissue when you cough or sneeze. Avoid close contact with persons who are infected or have symptoms such as coughing or sneezing. Clean and disinfect surfaces at home and at work. There are no medications to treat the coronavirus. Practice preventative measures to ensure that you and your family are safe.
This message brought to you by Bahamas Ministry of Health in conjunction with Guardian Radio.
Always on the go? Missed the show? You can now listen to Guardian Radio talk shows anytime, anywhere on Spotify and YouTube by searching Guardian Radio 96.9 FM or by entering the name of your favorite show. You can also listen by logging on to GuardianTalkRadio.com and clicking on the podcast tab. Guardian Radio, continuing to provide you with fresh news and smart talk anywhere, anytime, all day.
There comes a time when the game tolerates no spectators, only players. There comes a time when we must recognize that our individual aspirations shape our collective destiny. There comes a time when getting in the game, despite the risks, despite the challenges, regardless of the cost, is simply the right thing to do. There comes a time when we must find our hearts, find our soul, and pursue our purpose for the greater good of all, for country, for humanity. There comes a time when we must manifest our true greatness. Yes, there comes a time, and that time is now. So let's get down to the essentials. The essentials. Serious radio for serious people committed to advancing the national conversation.
The Essentials with Hubert Edwards, Thursday nights live at 6:30 p.m. to 8 p.m. on Guardian Radio 96.9.
Hi, I'm Amanda Coulson, the director of the National Art Gallery of the Bahamas, and your host on Blank Canvas, the show in which we speak about visual culture and creative community. When artists look at a blank canvas, what do they see? Not an empty void without meaning, but a horizon of infinite possibility on which they can bring their dreams and ideas to fruition. On the Blank Canvas, we have lively discussions about art and culture in all its aspects, with creative thinkers and cultural leaders from the community. Learn about your visual culture and creative community. Tune in and listen to The Blank Canvas on Wednesday evenings at 6:30 on Guardian Radio 96.9.
Morning Blend Business.
The economy.
Finance.
Business.
Industry.
Government sector. Private sector.
Financial services.
Tourism.
Personal finance.
Investing advice.
Consumer issues. Consumer rights.
Trends and business opportunities.
Morning Blend Business. Following Morning Blend every weekday from 9 a.m. to 10 a.m. right here on Guardian Radio 96.9.
It's a hit back with the hash of black. It's a hit back with the hash of black. It's a hit back with the hash of black. It's a hit back.
And we're back. You're listening to the Hit Back with Nahaja Black, Guardian Radio 6.9 FM. I want to say a special thanks to everyone who's tuning in online and in your vehicles, who are, from abroad or overseas, I guess we'd say. And we have a special guest all the way from Tokyo, Japan, my good friend, colleague, all the way wearing all of his masks. So I know my boy is making sure that he's safe. Sheldon Longley. Sheldon, welcome, buddy.
Hey, Naja, thanks for having me, man. How you guys doing on there?
Well, we're doing well, as good as can be. We're looking forward to some good news from Tokyo. I see you are misrepresenting the Bahamas by wearing this Dolphins mask, so we will forgive you.
Hey, where I go, the Dolphins go, man.
Bad mojo. Bad mojo.
Gotta represent everywhere. Gotta represent for my team.
Listen, and I see, of course, you are wearing Team Bahamas Olympic gear. So thank you so much for being there. And I know, of course, there's a lot of COVID protocols, and we're going to touch on that as what's different. And I know you've been to Olympics before. You've covered Team Bahamas before. So I want to ask that first. I think let's get to that. What has been different? This is a different Olympics. We postponed it from last year to this year. The Olympic, IAAF, not IAAF. What is that? The Olympic Committee, whatever. You know what I'm trying to say. And so it's been postponed. There you go. And so now we are here, but Tokyo has had some restrictions. There have been a lot of restrictions. Give us an idea of what it's like, these Olympics in Tokyo, Japan.
Well, Naja, the quick answer, the easy answer would be COVID itself. These are known as the COVID Olympics because of everything that's happened, while we're here in Tokyo. As a matter of fact, even before we arrived, we had to start recording our health status up to 7 to 14 days before you actually enter Japan. And then you have to take 2 COVID tests before you enter, and then take another one at the airport. So it was 3 in total. And then for the first 3 days for your time in Japan, you're supposed to take a COVID test. So it's just regular updates. There's a lot of restrictions, a lot of precautionary measures in place. They're advising you to always sanitize, always wear your mask, social distance. Even when you're interviewing the athletes, which was kind of different for us this year, it would be at a distance. They would take your recording devices or your phones or whatever, they would put it in a little basket, and you would stand like about 3 to 4 feet off, and you interview them from a distance. So everything is pretty much secured. They're taking no chances. I know there's still been some minimal cases of positive tests, but for the most part, it's kind of restrained, kind of reduced. We're pretty much safe. We're doing what we can to keep ourselves safe. I saw, unfortunately, that one of our athletes tested positive in Nassau, but over here in Tokyo, for the most part, everybody has had a negative test, and we're maintaining within our own circles. For the media guys, we couldn't even come at the hotel for the first 2 days, so that's how bad it was. But we're adjusting, and we understand that what needs to be done in order for the games to come out successfully. And so far, it's been a very good Olympics, I think. Our swimmers performed very well. Joanna finishing 13th and 18th. That's top 20 in the world in both of the disciplines.
Wow.
And then Isaac, of course, this is his first Olympics. So to get out there in his first Olympics and almost swim a personal best time, it kind of shows the performance that he had. So far it's going pretty good. We're looking forward to track and field starting on Friday. We got our high jumpers up first, Donald Thomas and Jamal Wilson. And then we get Nia Gate going after that. So we're anticipating some great results in track and field.
Yeah, that's what I'm glad you went there. So let's get there, because of course, swimming, I think a lot of us, well, I was definitely, I'm not surprised by the results of swimming with our female swimmer. I knew her, what she's been doing through the course of her career. Young Isaacs was new to me, so it's good to hear of the good news there. But now track and field, of course, this is where we, as a small country, we shine. And let's start off with the world champions that we have, right? So we have world beaters. We have Shawnee Miller-Weibo, and we have Stephen Gardner. We know that there's another 200-meter runner right now who is leading in the world other than Shawnee. And Shawnee had her first defeat, I think, in recent months, if I'm correct. What are we in recent years, not months, years, right? What are we anticipating in track and field this year?
For Shawnee, the 200 is going to be a challenge. There are a lot of girls out there who are running very, very fast. As you mentioned, the American Gabrielle Thomas, she became the second fastest runner of all time behind the late Florence Griffin Joyner this year. And she ran at 21.61 at the US trials. So she is the favorite going into the women's 200 meters. And then you also have Shelly Ann Fraser-Price, who ran a place best this year.
Yeah,
and you have,
Shelly's rolling.
Yeah, Shawnee beat her a couple of weeks ago leading up into the Olympics, but Shelly Ann like she wasn't at her best. And she's going to be ready for the Olympics. Then you have Sharika Jackson, the other Jamaican. She ran a place in the best this year, and she defeated Shawnee about 2 to 3 weeks ago. And that's the loss that Shawnee had for the first time since 2017.
That's right.
So the 200 meters is definitely going to be a challenge. I was glad to see that she has decided to do both events, 200 and the 4. The 400 is more open, given the ban that was placed on Nasser. She's not here. And then the two young Namibian runners who are running very good, they're not here as either. They have some challenges as well. So the field seems to be very open in the 400 meters. So it's going to be much easier for her to win a gold medal in the 4 as opposed to the 2. But like I said, I'm glad to see she's doing both events. So there's definitely a possibility of winning 2 medals. Stephen has entered in 2 events as well. He's entered in the 200 4, but I'm pretty sure that he's only going to do the 400. But the 200 he could make the final. It'll be hard for him to win a medal in that. And in the 4, he's one of the favorites, along with the world record holder Van Niekerk and the American Michael Norman. They're the 3 favorites in that event. So, but Stephen is the defending world champion. he wants to prove that this in 2019 was not a fluke, and this will be actually the first time that he, Norman, and Van Niekerk race against each other. Should all three of them make the final? So that would be interesting to see, and everybody's looking forward to that. So yeah, two of our marquee athletes, we're expecting great things from them, and then we also have the hurdlers, Devin and Padrillo. They get their competition started on Saturday. I expect Devin to make the final. She's been running very, very well this year.
Devin Charlton.
Padrillo, yes. Padrillo, I think it's going to be a little bit more of a challenge for her, but she could certainly do it. Nobody expected her to make the final 5 years ago in Rio.
That's right.
But she did.
Yeah.
And she did, and she finished sixth. So she's a competitor. I think she's going to go there and she's going to give it her all. And we could possibly have two women in the final of the women's 100 meter hurdles, which would be historic.
Wow.
Which would be historic. I'm also looking for good things from Tania Gaither. She has made the final 2 world championships back to back in the women's 200 meters. And I know the field is a little bit more stacked this year, but I'm not going to put anything past Tania. She's a gutsy little runner. She has a lot of heart.
Right.
And then we also have Samson, who's running the 100 meters. If he could duplicate that effort from the NACAC championships, he could possibly try to advance through the rounds. Our high jumpers should be pretty okay. I think overall we're looking for some good performances. This Olympics, we could come away with about 3 to 5 medals.
Man, stop it. Don't get a sister excited in the time of COVID. Sheldon, don't get me happy. And go ahead.
Yeah, we're just anticipating track and field to start on Friday, man. I'm looking forward to some great results.
Yeah, no, I think this for us would be the great distraction that we need, right? So the time difference, you guys are 13 hours ahead. So
Yes.
when you talk about track and field, and so for the record, thank you again for saying yes to this. I love you so much, and I owe you big time.
You much people could get me up at 6 o'clock in the morning. You're one of them. So
I know, I love you too, buddy. And because this, I know what of course, 5:30, you and I are chatting, so I thank you so much for it. So if we're talking about 13 hours ahead, it's already, what today is it for me? Wednesday, so it's Thursday for you. What are we talking about in the schedule? So tomorrow evening for us or early in the morning? I'm trying to think of the schedule for track and field. Where can we go to get the schedule?
That is correct. Our first events are going to be early Friday morning first. I think it's 9:15. 9:15 Friday morning, which will be Thursday night for you guys at 8:15.
Okay.
So, I want Bahamians to get ready because it's going to be exciting. Be aware of the time difference. And note that everything that we mentioned here in Tokyo in terms of time is 13 hours ahead. So be aware of that. Set your clocks. Get up early to watch the races. There are going to be a lot of finals in the morning, early in the morning, like 6, 7 o'clock in the morning. This is going to be like Sydney in 2000, I believe.
That's what I was thinking.
He's getting up 4 or 5 o'clock in the morning to watch the Golden
Yes.
Girls.
Yes. Yes.
This is going to be like that. So set your alarms. Get ready, get up early, because we're going to see some exciting results, and I believe it's going to be goal again.
I'm with you. I think so. I'm really excited about what we've got on the forefront, and I think that this is good for us. I think it's great for us to know that our athletes are still out there representing, and no matter what's going on here. Just for the record, I realized that you and Marcellus have the good gig. Yeah. So watching y'all, right? Y'all got the good gig, right? Y'all in Tokyo, braving COVID. Like, you ain't scared.
Well, it's a challenge. It's a challenge, and we recognize that. And we recognize the importance of staying safe. And we also recognize the importance of delivering the news to the Bahamian public. So we're going to go out there and we're going to do our jobs, and we just hope it's good news, we saw there's been some challenge with the women 200 meters.
I was just about to say, there's controversy already. Why is there not one Olympics where we can't have controversy? And I'm glad you brought it up because I almost forgot. I'm getting calls here. Anthony Strawn has been made an alternate, even though she qualified at home and came second place in the 200 meters. I'm getting calls here from Tokyo on that. What is the situation there?
Well, the situation is that no entry could be confirmed until the day before the event. So there's still a chance that she could run. Right now, the management team here in Tokyo, all they did was just submit the entries, and they only could submit 3 entries. So somebody had to get left out. But that doesn't mean that Anthony will not run the 200. It just means that those are the entries for now. And there will be confirmation one day before the running of the heats of the women's 200 meters. Now, what I am hearing is that there is going to be a runoff because there is there's a little bit of misunderstanding in terms of who should be running. Anthony ran at the nationals and she qualified at the nationals.
Yes.
But the BOC is saying, hey, look, this is our team. We have the right to put whoever we want to put there to run. And their stance is that we're going with the 3 fastest times. That has always been their stance. The 3 fastest times in the qualifying period would be Shawnee, Tania, and Brian. So Anthony could be the odd person out. But Anthony did what she was required to do, which is go to the nationals, qualify at the nationals, and finish in the top 3. And according to BAAA rules, once you do that, that's automatic inclusion on the national team. But the only issue is this isn't the BAAA team, this is the OC team. So they call in the shots. But I understand there's going to be a runoff today. I'm looking forward to that. I'm looking forward to see what happens from that runoff. I wish the runoff would have included all 3 of them, Brian, Tania, and Antonique. Right. I'm hearing that the runoff is just going to be Antonique and Brian. I'm trying to understand the reasoning behind that.
Yeah, I don't understand that.
But
that's
all
right.
It's
still continuing to show favoritism there, but
Yeah, and to have that runoff like a couple of days right before the event, that's a disadvantage to the athletes.
Yeah.
Right at this point, their mindset should be on running in the 200 meters. What I need to do, getting prepared to run, and just going out there and run. It shouldn't be on running a runoff at this point.
Yeah, I was told that Antonique is very, very upset and hurt about it. So I'm happy to hear of a run off. There's something about a white flag. What is that?
A white flag?
Yeah, running under the white flag. I don't know what that is. I was told that was even something that was considered, that she would run under a white flag. Have you heard of that?
I've heard something about her filing an appeal. If that's what they're coming at, I think that's maybe what they're relating to. Mm-hmm. I heard that she might have filed an appeal to World Athletics, gone above the BAAA and the BOC, and they're still waiting to hear a decision on that. But at this stage in the game, I just think everybody's mind should be focused on doing the tasks that they are required to do. It shouldn't be any ifs or ands at this point. Competition starts tomorrow.
Yeah,
exactly. 200 meters is in a couple of days. So if they were going to have a runoff, it should have been done in Nassau. That's
exactly. I agree. Sheldon Longley, thank you so much, my friend. I appreciate the time all the way from Tokyo, Japan, senior sports editor here at the Nassau Guardian. Stay safe, buddy. Thank you so much.
Thanks a lot, Nahasha. You do the same. We'll
Listen, just brace yourself though, because when we win gold, I calling you. Okay?
That's not a problem. 3 gold medals.
Every goal, just know, expect
I'm greedy. I want 3 gold.
You're on the show. Just brace for it.
Okay, I'm Shawty doing the 2 and the 4 and Stevie in the 4. I'm looking for 3 gold medals.
At least 3. I'm with you. Thank you, buddy.
Yes.
I appreciate you.
All right, take care. All right.
You're listening to The Hit Back with Nahaja Black. Special thanks to Sheldon Longley. They're from Tokyo, Japan, keeping you guys updated. Amidst all of this, there is some good stuff. The time tomorrow night, 8:15 p.m. That's the time. Sheldon, is that right? Tomorrow night, 8:15 p.m. We'll be seeing some of the first track and field events happening for us. I'm excited. But I tell you, Pedrea Seymour, Devin Charlton, Bria, we've got Brianne, we've got, of course, Shawnee Miller, Weibo, Stephen Gardner. We've got a lot of people. We've got high jump. I'm so excited. All of that, thank God for the Olympics, eh? I got some text messages I need to get to before we go, because there was some actually there. I had a text message that was like text of the day, right? Text of the day. This is the winner. If I had something that I could give away for like text of the day, I would give it away for this text. Hi, Nahaja. John Pinder, Jennifer Dobson, Zane Lightbourne, Nicole Martin were all union presidents now turned political candidates. The history of politics in the country has been union presidents building their popularity so that they can be nominated by the major political parties. Why should I respect the sincerity of these unions now protesting? Y'all please leave my light on. Thanks. Gotta love, that was the text of the day. Text of the day. Kermit, we should make like a sound for that, for every text that comes through. Let's see. Great show as usual. I had a situation before I thought I had something bad and search. Okay, that one I can't read that one. Okay, that one was a little difficult. It sounded good, but I might not say it right. So, for the record, there is a meeting now, half BPL confirming with this press conference. And I was hoping to get some information before the show was done. The press conference is happened at 4 o'clock. I don't even know if it's completed yet. BPL holds a press conference. I feel like, that was Quincy them making sure that I don't get to say anything about it on the show. But BPL were their staff that called in sick. It's a sick out, right? Official or unofficial. I've been trying to get the words from the union president. I haven't been able to reach him today. But everyone, I know you all heard a voice note circulating. Everyone, get ready. There will be a sick out. I don't know if you heard that. So that's something to keep in mind as well. There was something else that I wanted to share with you on my phone. Let's see. There's something else on my phone I wanted to read to you guys. It says, okay, Mrs. Black, there are a few hotels that don't care less about their room attendants, right? They still demand them to clean the guest rooms without even spraying Lysol before they enter the room. Lack of safety equipment, only thin masks and sanitize. But remember, they're entering a room with air conditioned while it's cleaning. Most attendants don't wear masks properly. God help us, they can't complain. If so, they are removed off schedule. And so they're just suffering in silence, right? You're off of the East now? Someone said the lights off in the East. Look, there's so much going on in this little country of ours, where I can't keep up and we can't keep up. So the lights are in and out. We've been in our BPL PR group. You can always tell when the lights off. We are notified. Because someone is saying, hey, why are the lights off in this area? So BPL is having this sick out allegedly. And so that's what we were going to find out with this press conference. And so there was a sick out for real. I have someone that works there. Yes. And I do believe that it's real, but I just was waiting on the confirmation from the press conference. Everything that I've gotten is that it's real. There is a sick out going on, and we'll see how that's resolved. This is the sick out at BPL. Lunchtime protests with social services. I didn't see the social service workers having a protest. The nurses were if there was going to be a protest, it was preempted by social media attacks against Amantia Williams, the union president for the nurses. But I know the nurses are frustrated. There's a lot going on. And you're right, Rasta God, y'all better charge your phone. You better charge your phone. Go charge your phone, child, because I don't think charge everything. I'm just happy that my light stayed on during this entire show. Then I got to go in studio. And, I try to avoid COVID. And actually, can I just say, for the record, my station never gets COVID. my station never. We don't get COVID. What it is. Let me see where it is. I got something here that I've been told to read. Oh, all right. Okay, I got something. I have something. A BPL statement on the industrial formally made an offer of pros. Okay, let's go. I got a statement. Thank you, my producer. BPL formally made an offer of a proposed industrial agreement with the Bahamas Electrical Workers Union on Tuesday, July 27th. It is unfortunate that our offer appears to have been made public. It also appears that some members of staff chose to participate in an industrial action on Wednesday, July 28th, which we find regrettable. We would like to make it clear the company is and has been eager to sign an industrial agreement with the BEWU. We have honored the spirit of the IA, which expired in April 2018, to the extent that every increment and bonus has been paid up to June 30th, 2021. We reiterate that despite the depressed economy as a result of COVID-19, no employee was laid off, and we continue to meet all of our financial obligations under the expired contract. Even now, we await the BEW counteroffer so that negotiations can continue in good faith. The compensation record, as noted, the old IA expired in 2018 of April 2018. In honor of the expired agreement And because we care about our employees, we paid in June 2018 annual increments and incentive bonuses totaling $511,000+. In December 2018, we paid the annual bonus ranging from $700 to $1,000 per employee for a total payment of $578,000 in 2019. The total increment, and then they go on, blah, blah, blah. In this fiscal period 2019, BEW members were paid base salary of $32.1 million. Line union members were paid $10.6 million in overtime. Average cash compensation to BPL union members. It goes on and on and on. All right, that's on our news Facebook page. Everyone, more information. Charge everything anyway. People stick out. You're listening to the Hit Back with Nahaja Black, Guardian Radio 96.9 FM. See you tomorrow. Post the Prime Minister's his speech tonight, 8 o'clock. Tune in. We'll see you tomorrow.
It's the Hit Back with Nahaja Black. It's the Hit Back with Nahaja Black. It's the Hit Back with Nahaja Black. It's the Hit Back with Nahaja Black.